to welcome everyone to Family Health Foundation Health Talk Show. Today we are going to talk about ADHD, attention deficit hyperactivity disorder. It's quite an interesting and should I say a diagnosis or a problem that's shrouded in a lot of mystery, or a lot of there are a lot of perceptions about it. Some feel it's a diagnosis just for boys. Some feel it's a diagnosis that some way or somehow makes you a genius. It's interesting that you have people such as Einstein, Da Vinci, Will Smith, Richard Branson. I've seen Michael Phelps, yes, and others. Like if you look at the spectrum, so from sports to music to acting to science to inventions, you have people who have been diagnosed with ADHD at a point, and they've still been able to achieve such greatness. But some still view it as a mental disorder. So today we have with us Dr. Ruth Charlotte Saki. She's a specialist psychiatrist and a child and adolescent mental specialist, or is it mental health specialist?
Yeah, mental health specialist.
Yes, with the Confano Teaching Hospital to help us talk about ADHD. Dr. Ruth, you are very welcome.
Thank you so much, Dr. Omani, for this opportunity and the good work you are doing.
Oh,
I'm glad to be here.
I'm also glad to have you on such an interesting topic such as this. So sure. I saw that you did some research in Malawi on the prevalence and I think the prevalence of mental health disorders in children and adolescents. One of their, I think, Blanta in Blanta.
Yes,
yeah,
one
Blanta,
of my colleagues from Malawi, Dr. Ian. Yeah.
Okay. I was wondering, is there a similar study in Ghana to sort of know the prevalence and of mental health disorders, especially in children?
In Ghana. Yes, there is a similar study done by Dr. Kusi Mensah. The study is not out yet as published, but we have the figures, and ADHD is kind of the third most possibly commonest disorder when it comes to mental health disorders in children and adolescents. I don't have the percentage of heard, but I'm going to provide that soon. But the prevalence worldwide is mostly ranging from between 1 to 5%. Other studies have reported up to 9 or 10%, but we'll take an average of 5%. So that's like 1 out of every 20 children could be having ADHD. So it's quite
And is it reported? Because growing up, I remember if there was a child in your class, or you had a friend in your class who couldn't concentrate, or who was, hyperactive and all over the place.
Okay, so
they will just label him as maybe not interested, or maybe he's not. Okay, yeah.
Oh, sorry. Go ahead, because I think the line broke a bit. Go ahead.
Yeah. So I was just saying that from my experience with our educational system, we tend to quickly label children as maybe this person is a shark. This person is not a shark. Maybe for this person, maybe school is not for him, and maybe he's shunted to maybe some manual work or some trade of a sort. So I'm intrigued to know whether do people bring their wards or their children to the hospital and for things such as ADHD, and probably that will lead us to talk about some of the symptoms that you might pick up for with a child who is suffering from such disorder.
Okay, thank you so much. It's a very important question you have asked. The simple answer is yes. We are currently seeing now more and more children being brought into the hospital to be seen and cared for ADHD. I mean, it's getting better and better as people get more informed, more educated, and they get to know and understand some of these challenges that these children have. And also definitely as some of us gets more and more knowledge into these areas, because definitely it wouldn't be like ADHD has not been there. It has been there. And in each of us our growing up experiences, we have had people in our classrooms that we grew up with that had ADHD actually, but we probably didn't know that they had ADHD. We have them mostly being labeled as not being naughty, being too careless, being in quotes the stubborn, child in the class, or the one who is mostly
the
not
stubborn
doing,
child,
because of the kind of
the
system
backbenchers
they
assembly.
exhibit. And they are mostly backbenchers making the noises. Every now and then teacher will have to say, keep quiet. Within 2 minutes or 2 seconds, the person starts, talking again, moving from decks to decks. They just cannot, keep attentive and still for as long as you need to have them be. So they make most of the noise at the back, So it's now something that because it's a field I deal with a lot. I see children every time with ADHD that I have to manage. And like I'm saying, as people get more knowledge into understanding that these children are not just stubborn or just intentionally behaving that way, they are now able to, do what is rightful and seek help for them, because we do have interventions that could help such children. Else, the outcome is what we see today. The outcome will be children growing up into adolescents, into adults who unfortunately could not accomplish much in school because they were always, in quotes, the rowdy type, or they couldn't really keep attention. Therefore, though they may have good intelligence level, but that problem can make it very difficult for them to achieve high in the academics in school, and they rather end up, in none or less skilled jobs. And the truth is that a lot of them can end up in jobs that are non-skilled. Example is a study we have done among trotro drivers and taxi drivers, which has found the high prevalence of ADHD amongst them commercial drivers. And that can be explained now, with the kind of lawlessness on our road.
Can that be related to the accidents?
Yeah, definitely. I'll come to the symptoms.
You're not paying attention.
Yeah, I'll come to the symptoms of ADHD, and you get to understand, how the dynamics on our road plays and the accidents and all that come into play.
This is very interesting.
Yeah.
So then it means that part of tackling road safety should be going back to our primary schools and our nurseries to evaluate our children. I think that if we can solve, or if we can maybe diagnose them at an early age, I think that's better. I think we'll be better able to prevent these road traffic accidents. I think
definitely.
It's an interesting definitely. Research. I think it's an eye opener to me. I mean, like yes. Okay, so let's backtrack a bit. So when we talk about ADHD, is it a mental disorder? Are you born with it? Do you acquire it? Is it from your mother, from your father? Is it from a witch somewhere? Is it from maybe your mother ate some egg, or maybe she ate corned beef? I mean, like, how does it come? Or maybe your father watched maybe some Manchester game, and because Manchester didn't do well.
Interesting.
Watch Real Madrid. Watch Real Madrid, but he watched Manchester, and Manchester has caused you ADHD. I mean, what brings it up?
Very, 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 very interesting and very important examples of possible causes you have given, because people do have a whole wide range of, ideas when it comes to ADHD and probably other conditions that we'll be talking about later. But yes, ADHD, for those who don't know, it stands for attention deficit hyperactivity disorder. So the words in there describe the condition. Okay, there is a problem with attention. That is why it's an attention deficit, disorder. And then there is a problem with activity, the levels of activity. So there is hyperactivity. So yes, it is a disorder. It is characterized as a neurodevelopmental disorder. A neurodevelopmental disorder. So
it's not like the person is mad.
No. So if I say neurodevelopmental disorder, we have two words in there. You're looking at a neurological problem, that is occurring. So that means that there is something wrong with the machine, the brain, There is something technically wrong. I'll be explaining what really went on, what goes wrong that brings about ADHD. And then it's developmental. And by saying developmental, that means that you are likely to have it experience it right, in your developmental stages. So you can say that you could be born having it, because then right from the stages of development, the problem is already ongoing, and by the time you are expressing it, it's early, in life as a child. That's why it's mostly seen in children, though it can still progress to adulthood. So we wouldn't just say it depends on people's understanding of what a mental disorder is, but this is not it's not really a mental disorder in the definition of a mental disorder. It's a neurodevelopmental disorder.
Neurodevelopmental disorder.
Yeah. And getting back to the etiology, that is the possible dynamics that come into play that may bring about the problem. It's not from a parent watching Manchester and then they get unhappy about the score, and then it's not about eating a certain food and then you suddenly got it. It is not about witchcraft, and all that. In our environment and culture, we appreciate our high superstitions, cultural values, and then beliefs. So I don't like to put it all in the garbage, but I like to let people have
put it into perspective,
a good concept of it in total. So we mostly talk about the biopsychosocial etiology of every condition. There's a biological aspect of the problem of ADHD. There is also the psychological aspect of it, and then the social aspect of it. Yes, so like I said, biologically, there is something technically wrong that went wrong, or that is not functioning well in the brain. That is why ADHD is occurring or manifesting. And to speak on that simply, it's a problem with the frontal lobe of the brain, the very, very frontal aspect. Even the more frontal part of the frontal lobe, which is the prefrontal cortex. And here, there is a certain imbalance or low levels of certain neurotransmitters. Okay, so to make it simply, you can think
for
like chemicals.
For the non
exactly.
For the non-new people,
Chemicals in the brain. Yeah, that is supposed to function to help people regulate their behavior. And see, it's like a traffic light. When you get to the traffic light, when there is a junction, the traffic is supposed to regulate, the flow, so that when it's red, the cars here have to stop for these to move, and then green means these people can go. But in those with ADHD, they don't have this traffic regulatory, mechanism functioning. So their main problem is with the executive functions of the brain. By executive function, I mean your ability to plan, your ability to be attentive to what is important before you and ignore what is not important around you, your ability to control which impulses to respond to and which not to respond to, and your ability to even control your motor, activity, plan things, organize yourself. So unfortunately, because there's a technical problem with that control, with that traffic system, those with ADHD end up being, in quotes, unregulated. And so they are unable to regulate their impulses. Once it just comes like that's very impulsive. And that is one key characteristic or symptom of ADHD. They are very inattentive. And so when something is going on, when they're supposed to be doing something or be on a task, they can easily be distracted by so many other things. While the teacher is speaking, they are rather focusing more on even just like the spinning fan, which everyone else could ignore, or something, a pin falling on the ground can take their attention more than the teacher who is loud enough and teaching in class. Their mind goes away like easily, quickly, okay, and tunes out of what is important and what is going on. Then hyperactivity, when I'm supposed to be sitting still, speaking to you every 2 minutes, I feel like I can't sit, like it's as if there are pins in their bottoms, that every now and then they want to get up.
Yeah.
And for children who are really hyperactive, you find them all over the place, running up, down, jumping, rolling over, like every kind of boisterous activity. And sometimes they are described as a motor that is, that has everlasting batteries, because they never get tired from morning till evening and be on the go. A motor with everlasting battery. So parents of such children really get exhausted having to control them. So just like a brief overview of the condition.
Okay. Is it a boy?
A boy thing.
Is it a disease of boys, or is it a boy thing or a girl thing? Because when you look up the ADHD, you realize that it's as if more boys than girls tend to get diagnosed. However, when you sort of look at it closely, it should have probably a 1-to-1 correlation, but it seems to have maybe like 2:1, 16:1, 5:1, but definitely more boys than girls. Is there a particular reason for this?
Yeah, very important question. And it also comes to the when we look at the etiology. Definitely, it's not like a boy's disease. No, we don't say like that. But boys are at a higher risk of developing ADHD compared to their girl counterparts. So yes, like you quoted all the figures, I'll take the average. The average is like 4:1. So with every 4 boys having ADHD is to 1 girl having ADHD. So boys are generally at a higher risk. And it's interesting if we have to go into why this happens, because this happens for a lot of all the neurodevelopmental conditions or disorders that we will be looking at.
That means
all the developmental conditions, the neurodevelopmental conditions are more common in boys than girls. Boys are more at
boy child.
Boy child. And this is what I always say when I'm teaching students. I am like, how society sees that women or girls are vulnerable. Biologically, it is not so. Developmentally, the male is at a very high risk of many problems. Don't be sad. Compared to the female. Okay, the female fetus. Okay, so this we are talking about right from conception. The female fetus has a higher resilience, in many ways than the male. So developmentally,
than the male fetus.
Exactly. once the X and the Y combines to form your, male, that whatever you formed then is actually vulnerable compared to the X to X, combination. So right from start of creation, okay, of the human being, the male becomes more prone. The reasons for this is still people have proposed different reasons and theories, but one of the commonest is X-linked disorders. The fact that the female has a double, X chromosome,
X,
while the
so it's
male
also
has only one. Once the
one.
male has a problem with the X, that is it. He's going to probably manifest that problem. Whilst the female may have the dominant one being fine and then able to suppress the problem. Then honestly, biologically, the female fetus is very robust and more able to withstand harsh conditions compared to the male. And let me say this interesting thing, since we have brought this up. I hope I'm still audible. So, there is a work that was done. I'm trying to remember the scientist's name.
I think it's very robust both in
Dr. Mani, I think.
Okay, yeah.
So sorry, I think there was a little bit of break in the network.
Yes. Sure, don't worry. Don't worry.
Yeah. We can progress, yes. Yeah. You were saying something that I also wanted to add something to what I said.
You're coming to tell me, I was saying that's very interesting. Like what you said, that we tend to see the woman as very vulnerable. However, biologically, for example, more male babies die than female babies.
Yeah.
Males generally have a shorter lifespan compared to women.
Yeah.
Males cannot withstand emotional trauma compared to females, although females are emotional.
Yeah.
Males generally cannot withstand certain stresses, although they have a muscular body. So, like what you're saying, biologically, the more resilient species is the female species.
Yeah, very right. And I was coming to this point to even go way before fertilization. Before fertilization, some scientists have theoretized based on some studies that the male carrying sperm, swims faster, so they are fast. They are faster in reaching the egg. However, they die more quickly. So the male carrying sperms, die faster. So they swim faster, but they die faster. Whilst the female carrying sperm is going to probably be slower in reaching the egg, but they stay longer. Okay, so then what happens is, if the egg was supposed to be released on day 3, and probably the male and the female had copulation today, within the release of sperms, the sperms are going to swim fast. But of course, by the time they get there, the egg is not there yet. So the male carrying sperms are going to die faster. Then the female carrying sperms are going to still be in the system. Most of the males carrying sperm would have died, while the female carrying sperms would be still alive by day 3. So that by day 3, the egg is released. The likelihood that they are going to rather meet, an X carrying sperm, that is the female, bearing sperm, is higher. And that is also one of the reasons why females are more likely to be born than males, because in once there is ovulation, once the egg is released, the sperms that are more likely to have endured till that time and be able to fertilize the egg will be probably the X carrying sperm. So, I mean, it even shows that right from the start of creation, female chromosomes, female carrying sperms, the female zygotes is more biologically resilient than males, and with all the observations you have correctly made. So, though society makes it otherwise. In society, the female is given a role that makes her more vulnerable, or yes, culturally more vulnerable, but actually biologically we are more resilient. So that is why all these neurodevelopmental conditions are more common in boys than girls, for this very biological reasons. And it's the same with ADHD, but it does occur in girls as well. So I see girls with ADHD, I see boys with ADHD, but we are saying that if you should look at the probability or the risk, the main word is the risk, the odds, then males have a higher odds of having ADHD compared to females. Yeah.
Interesting.
Yeah.
Wow. I think that'll be another conversation another day, because those are very interesting stuff.
Yeah.
Okay, so now, but back to ADHD. So what can be done for a child with ADHD? Because as I said, we have people like Einstein, Da Vinci, Richard Branson, like people who've gone ahead and been very, very successful. So then obviously it's not a limiting. It doesn't another context. What are the options available to a child who is diagnosed with ADHD? Can that child become the next president of Ghana? Can that child become a Lee Kuan Yew? Can that child, become the next Professor Alote, etc.? Or that child is bound to maybe like the research that you said, that child is bound to become a church driver or a church mate or a taxi driver. What's the prognosis like when we look at children who are diagnosed with ADHD in Ghana?
Okay, very, very, very good question. And yes, to your first assertions, yes, a child with ADHD can be a great person, and that is our hope. But no, if nothing is done, about it, then the outcomes or the prognosis is going to be poor, because children with untreated ADHD are likely to have other problems as they are growing up. So when ADHD is not attended to, if you leave someone with ADHD like to chance, the likelihood that they'll have a poorer outcome and not be the Einstein or the Lee Kuan Yew and the people that we want to see is higher than they becoming fulfilled. When ADHD is not treated, the child can easily have school failure, because they are likely not to do well in school, not because they are dumb, but because they have a technical problem that makes them unable to sit, focus, and attend to their studies. They are likely to be teased by their friends, rejected by their peers, because they are always the people who are scapegoated. They are the people who the teacher is always going to call and keep whipping and be suspending and all that. They are likely to have a low self-esteem of themselves, because they are not happy with themselves. It's not like they enjoy what they do. They just can't control themselves. So they're going to have a low self-esteem. They're going to get depressed, as a result of all this. Accidents are very common, in such people, not just accidents like the road traffic accident, but even they themselves getting injured because of the kind of boisterous activity, dangerous activity that they engage in, where sometimes they are not able to see the risk that the risky behavior that they are involved in. They can easily also progress into other maladaptive behaviors like abusing substances. They are very, very impulsive. So anything like they want to try it, they can be very curious. So they can be the ones that will easily, start abusing substances. They can then end up with conduct problems and develop other disorders we call conduct disorders. and conduct disorders, that means now they've actually become, in quotes, stubborn and are even breaking very important rules of society. And when that happens and they keep growing up like that, then they can have antisocial personality, where now the society finds it difficult to even deal with them. Okay, so some may end up as thieves and robbers and others out as a result of that. Okay, so, and it really can affect the family so badly to handle such a child with all these bad prognosis. But like I said, this is when we don't do anything about ADHD and just leave it to chance. Now we let's look at the good side. We've had wonderful people in history who have had ADHD, and they are having ADHD could be a blessing. Why am I saying it could be a blessing? I'm sure they have had some help of some sort, but their impulsivity, their risk-taking, have also helped them to do things that have changed and transformed societies, nations, their own lives and all. I personally have two, should I say, mentors who have come. I would really say they have ADHD. They have ADHD because you can see those traits, but it is ADHD that they have converted into, positiveness. Okay, so that energy that they have so
great.
much has.
Wow, that's amazing.
And you see them doing a lot of things, like they do things. They make things like they push things because they are like their energy is up there. And at that stage,
they have everlasting batteries.
They have everlasting batteries, and thankfully, the everlasting batteries is being, used for things that are more resourceful and then making things happen. So such people, you give them tasks from morning till evening, they don't get tired. Like they some of them can be very good organizational leaders or movement leaders and pushing things to happen and all that. But that is when, as children, they have been managed, and then they have had interventions put in place to help them divert their energies into more reproductive activity, more productive activity. So yes, there are interventions for children with ADHD, and that's what I want to talk about briefly. We need to, one, understand and be able to identify when a child is having challenges. Okay, if the child is too hyperactive around you, if the child seems quite difficult to control around you, if the child seems very, very impulsive around you, and I'm just going to give an example to make it easy for us to understand, because just like 2 days ago, I had a call from, outside Ghana regarding a child of someone. And the mother was worried because the child seems to butt into everybody's conversation. No matter how respectable you are, the child can just say something like, without thinking about it. And the mother has gotten so uncomfortable about it and realized that the child is too free and too outgoing and will not say when they are out. The child wants to talk to everybody. And, after assessing, I realized there were a lot of impulsivity symptoms and some hyperactivity symptoms and also inattentive symptoms. So the child did fit a diagnosis of ADHD. And the mother was very worried, and I told her, she was like, can anything be done about this? I said, yes, that's why we are having this conversation, and we would have to, intervene, because according to the mother, she had seen such traits in the child's father, which had been very problematic for her, and had even broken down the marriage. So, so that could be a case of untreated ADHD. That is still a difficult, even in adults. So we have to intervene. In the intervention, we do have treatments that we have to institute, and the treatments are in twofold. We have the psychosocial treatment or the behavioral treatment, and then we have the medical treatment, that's medication. So the behavior interventions are are things that we teach the parents, we teach the teachers they can do that will help the child. We teach the child they can do to help them get more organized. Something as simple as getting a planner, a timetable for yourself, reminders, organizing your day, and being reminded about them, because they have a technical problem, like I said, that it makes it very difficult for them to be organized. So there are simple things that they need to do to help themselves. And even we all who even say we don't have ADHD, you know how sometimes it's difficult for us to, organize ourselves and then remind ourselves. So how much more them? So we teach them so that they can have timetables, they can have planners, they can have reminders, they can download apps that help them to organize their day.
So they need more structure. If I'm getting that, they need more structure,
more prompting. Example, we teach parents and teachers of handling a child with ADHD that if you are giving an instruction to a child with ADHD, you don't combine 3 instructions in one. Kofi, go to the room and pick my shoe from under the bed, and the Bible, open to the middle page and take the money from me. After that, bring my headgear. By the time you finish, the child has forgotten everything you have said, and they may go and come back with nothing, or probably do nothing of what you've said. So we teach them that if you're giving an instruction to a child, give it one at a time, and get a child to repeat what you have said to be sure that it's really registered. Because those who are very inattentive, though they may be watching you, they've already tuned out, and before you finish speaking, they have forgotten what you've said, or they didn't even really catch it, and they can go and come back without having performed what you said. So there are very, very specific behavioral strategies that we teach that would really, really help them if we continuously implement them and help them through it. So yes, they need more structure, and we teach that. Then the other umbrella is medications, because there's technically a biological problem ongoing. And like I said, some imbalance or insufficient or inadequacy of certain chemicals in the brain. We do give medications that will help, stimulate the prefrontal cortex, that part of the brain. So we give drugs that we call stimulants, and then at times we also add on others we call non-stimulants. And these drugs are specific for ADHD. It's not drug for madness. It's not drug for mentally ill. It's
Great.
So like I was just talking about the medications. Medications are designed specifically for ADHD. If a child is assessed and seen to have ADHD, and we see that the problem is at a stage or a level that is really disruptive in nature, we may initiate the medication treatment, the pharmacological treatment, so that the biological aspect of the problem can be handled. But we don't do medications alone. The psychosocial aspect of the management is very important. And aside even the behavior of the child themselves, those around also have to be trained. Parents have to receive training on how they should handle such children, because a lot of parents already from scratch, the approach to such a child is wrong, and that is not going to improve the problem. It's going to worsen it. So parents who think that children with ADHD can be beaten out of them, no, you can't beat it out of them. Actually, you beat them till they become they will grow all the horns, and now your beating will mean nothing. It would rather probably make them depressed or make them feel, ostracized, or abused, whichever way, because it is not like a problem of willful stubbornness that you beat it out of a child. You have to treat it. So we need to teach parents and train parents to be able to understand the problem and even know the methods they can use in the child rearing. Okay, we have methods we teach them using conditioning, classical and operant conditioning. These are techniques that all
that's right. I remember classical and
all those things have importance when it comes to especially
that's great.
children, and then their behavioral, management. Yes, so
Management.
a lot
That's
of
great.
those with ADHD do well, when we help them. Okay, and I can at least look back at stories of some children that I've seen improved, regarding their ADHD, and are doing, well, are doing better in school, and they are now manageable. Parent is happy, teacher is happy, child is happy, so
Great.
we
Great.
help. Yeah.
So, okay. So, lastly, as we round up, so these kids do not necessarily need a special school. They can still maintain their the school that they are going to. They just have to incorporate all the things we are talking about. Okay, the planners and
Exactly.
organization and all those things. Okay.
Exactly. I would say emphatically, children with ADHD do not need to be put in a special school, especially not in Ghana here, because our special schools uh, are really special. But
Really
children with
special. Okay. So
ADHD,
these kids are not quote unquote Jimmy in our local setting.
not
As
at
in,
all.
yeah, not at all. Okay,
Not
great.
at all. The
Great.
truth is
Great.
that if a child has ADHD, it does not make them intellectually disabled. No. Children with
Okay, so
ADHD,
you're not intellectually disabled.
yeah, children with ADHD alone, some of them have very high intellectual function. Like I said, the people you have mentioned and the people that in real life I have seen are very intelligent people. It's just that aspect of their control must be managed so that they can be fruitful and productive in what they do. Those who were labeled as, let's say, stupid in class and always like at the bottom of the class, who may have had ADHD, they were not dumb. They were not dull. It's just that they didn't get the help they need. People didn't understand them, that they have a condition that should be managed. That's why probably they ended up, always at the bottom of the class. But if they were helped, they would have achieved, their good potential. And that's what we want to do now, so that we can help them, so that they can achieve their fullest, potential. Yeah.
Potential. Okay, Dr. Ruth, I think it's been a great time
Yes.
talking about ADHD.
Yeah.
Lastly, if you had a last statement to speak to parents, Sunday school teachers, guardians at nurseries, people who take care of children, what would be your words to them? Because they might have children who maybe their symptoms their behavior sort of fits on the symptoms you've spoken about. Maybe there's a guardian at a nursery who has some kids who are always, all over the place. They can't seem to sit still, lie still, etc. What would you say?
Thank you. Parents, teachers, and everybody who works with children, who takes care of children, I say kudos to you, because it's not easy caring for children, and you're doing a great work, because you're the ones who bring up, the best out of these children. Whatever we have become today, because we passed through hands that, nurtured us. So kudos to you all. I want to encourage everyone who handles children to have an open eye, especially for the older children. Usually from 4 years and up, a child is supposed to minimize certain behaviors that we probably would accept when they were 2 or 3, so that some of these hyperactivity and, being over playful may be fine, depend on their developmental level. If the child is 1, 2, 3, fine. But as they grow in their 4s and you find that these behaviors are not really typical of the others, as a parent, as a teacher, you need to not discriminate against that child. And I want to encourage you that once you find anything worrying, you find someone that is easily available to you to talk to. If you have the opportunity, especially to have either a pediatrician a psychiatrist, a psychologist, a mental health professional, or just any doctor, do well to talk to such a person. Anyone that is available to you, you can discuss the problems that you are seeing on the child with, so that the necessary next steps will be taken. There is help available for these children. They can also become good in the class. They may even be the next president that we've been waiting for, because like I said, they drive things to happen. So once we observe these things, let us help these children and their families to seek help for the child. And I believe that by and by and by and by, our children in this nation and then beyond will become very great and mighty people. Thank you so much for this time and for listening to me. I know my English.
Thank you. Thank you so much, Dr. Ruth Shabasaki. So we'll continue another time talking about more problems or issues with child and adolescent psychiatry and psychology. So stay tuned to Family Health Foundation Talk Show. This has been Omani Okra. Bye.